Is one of the most common plastic surgeries that a woman can get, but new research indicates breast implants could be the root of serious health complications.
Al spoke with a woman who 25 years after getting implants is finally learning why she's been suffering for so long. Atra?
Yeah, Janice and Derek, women have been getting breast implants since the 1970s, but despite being around for so long, there's still a lot that doctors don't know about why thousands of women claim that their implants are making them sick. But thanks to more women speaking out and sharing their stories following a recent recall, they're getting closer to a diagnosis.
Magazine covers, Cosmopolitan. I mean, we've all seen all the fashion magazines.
Leanne Crowell always wanted to feel beautiful. She grew up with sisters who had larger breasts than her, which made her insecure. So she got breast implants in 1994. Within months, Crowell went back to correct the placement of her first implants. Both sets were saline.
You know, I wanted to feel feminine and appealing.
But the movement of her saline implants made her uncomfortable, so she got textured silicone implants as part of a study. In the early 90s, silicone implants were taken off the market because of women reporting health issues linked to ruptures in the implants. Still, when her doctor offered to include Crowell in the study, she agreed.
Because I trusted him and his judgment, I felt confident going forward. So I didn't really question it or research it or think much of it.
It wasn't long before her health went downhill. She started gaining weight, experiencing extreme exhaustion and confusion. By 2016, Crowell was diagnosed with Hashimoto's disease, an autoimmune disease that damages the thyroid gland.
I didn't think about the seriousness of all of that. I just wanted to look good and feel good, like so many women. I mean, it's pretty normal.
When she went in for her yearly mammogram, her doctor discovered calcium buildups around her silicone implants.
I didn't know they were recalls because they didn't get recalled until after. They were removed in 2016.
That recall, which the FDA issued on July 24th, were for the same textured implants Crowell had gotten as part of the study in 2000.
These devices have been linked with ALCL, which stands for anaplastic large cell lymphoma, as the agent that can cause this problem 6 times more often than implants of other manufacturers.
Crowell immediately got new implants, but the result was not what she wanted. About a month ago, she started doing research about breast implants and autoimmune diseases. Turns out thousands of women have health issues they believe are related to implants, coining the phrase breast implant illness.
At this point, I think the jury is out.
Dr. Ava Timek at Advanced Plastic Surgery in Forest Hills says it's important for each patient to be aware of their genetic risk to things like cancer or autoimmune disease.
Number one thing to know is that there have been multiple studies and reports, over 1,000 studies and reports to investigate this issue. And to date, we don't have a clear answer.
Timek does not use textured implants, which are at the center of the recall. Timek has always been skeptical of textured implants and feels confident in the safety of her procedures.
You're going to get beautiful breasts, but there is some risk associated with it. The risk may not be high, but it's there.
In the thousands of patients she's had, Timek says she's only had 3 patients who have had symptoms like Crowell's and have chosen to get their implants removed. Timek says within months, they feel a lot better. And that's what Crowell says is next for her.
And I'm afraid of these implants now. And I think I want to just have them taken out.
She continues to feel sick, afraid of a diagnosis that could shorten her life.
At that point, I don't think I'm going to care if I have great breasts or not.
Now, just 5 days ago, 2 women filed a class action lawsuit against Allergan, the maker of the recalled implants. And Allergan says it would cover the cost of new implants for people with BioCell implants who want to replace them, but they will not pay for that cost of the actual surgery. The company says they'll do this until July 24th of 2021. Meanwhile, Crowell doesn't feel like she's gotten clear answers for the suffering she's endured in the last decade, but says she has found comfort in talking with other women who have gone through same things. Live in the studio, Atra Nashar, Fox 17 News.
I certainly wish you the best.